Hi, everyone. My name is Eva Ludovico, and I'm the Kanbar Cardiac Care Center's Program Coordinator, and I will be your moderator for the presentation this evening. Fortunately, my camera is glitching, so if it was working, I'd be on camera. So I want to thank everyone for joining today's community outreach presentation, What Happens When the Heart Attacks, which is sponsored by CPMC's Kanbar Cardiac Care Center. Today, we are fortunate to have CPMC's Chief Cardiology Fellow, Dr. Francesca Cazzulino, here with us to discuss the causes, warning signs, diagnostic testing, and treatment options for heart attacks. But before we get started, I'd like to briefly share a few words about the Kanbar Cardiac Care Center. The Kanbar Cardiac Care Center was originally founded in 2002 at the CPMC Pacific Heights campus and relaunched at the CPMC Van Ness campus in 2022. The center was formed through the generous contributions of the late Maurice Kanbar, who was an inventor, innovator, entrepreneur, but more importantly, a philanthropist. The Kanbar Cardiac Care Center is one of the highest-ranking cardiac health facilities in California and offers an array of cardiac services and specialists who use advanced technologies to diagnose and treat patients with heart disease. Its nationally recognized physicians, surgeons, and clinicians are committed to providing excellent personalized care in a contemporary and welcoming setting. So before we get started, I know you guys may have some questions during the presentation, but here are a few tips for engaging with our speaker. So during the presentation, to avoid disruptions, all participants will have their cameras off and microphones will be muted. Please type your questions into the chat or Q&A box, and we'll do our best to answer them during the Q&A segment at the end of the presentation. During the Q&A portion, you may request to unmute or use the raise hand feature to ask your questions verbally. And for anyone joining us by phone, please dial *9 to raise your hand or *6 to mute or unmute. And as a reminder, the information provided in this presentation is for educational purposes only. It is not a substitute for professional medical advice. So now I'd like to pass it along to Dr. Cazzulino to introduce herself and dive right into the presentation.
Great, thank you so much, Ava. I'm going to go ahead and share my screen here. Can you all see that? Okay, great. So I'm really excited to join you guys today to talk about this topic, which is something that, I'm dealing with every day at the Van Ness campus at CPMC. I am a cardiology fellow there, chief cardiology fellow, and I will be graduating in a few months and starting my practice down in LA. But it's been a really great experience being up here in San Francisco, and I'm going to miss this. And my actual background is in health education. I have my master's in public health, so I was very excited to get this opportunity to speak with you guys. So with that, I'll just jump right into it, since I want to be sure everyone has time for questions if they have them. So we're going to talk generally about, as Ava said, what is a heart attack? What happens when you have a heart attack? What are the signs and symptoms? How can we prevent heart attacks? And what's going to happen if you have a heart attack? But I think I wanted to start just broadly or very basically with what is a heart attack. Because I think it's something, you see a lot in the movies, you see in media, but it's something that understanding some of the basics of it, because I think can be really helpful. So when we think about a heart attack, this is my very basic representation of the heart. And the heart has three major arteries that supply blood to it. And all of the organs in our body require blood flow to get oxygen to be able to do their main functions, and the heart is included in that. So when we talk about a heart attack, what we're talking about is some sort of blockage or narrowing to one of these heart arteries so that not enough blood flow gets to the heart tissue. And the result of that ultimately is that the heart tissue gets damaged. And when tissue gets damaged in our body, we feel pain. We feel that acutely. And so that's why there's that classic sort of person grabbing their chest, as I had in my first slide, which is not advancing, because patients usually feel pain when they have a heart attack because their heart tissue is dying, basically. So this is sort of my representation of that. So you have a blockage in one of these arteries supplying blood to the heart tissue or the heart muscle. And there can be varying forms of that blockage. So I have sort of three examples here. So on the top, this is a normal artery. an artery is supplying, these are little red blood cells going through the artery, and it's supplying blood to the heart tissue. That's healthy, that's normal. What we see in the next panel is you can see this sort of yellow indentation that is narrowing that artery flow, that arterial flow and that blood flow. And you can even see on the left side of that little narrowing, there's more red blood cells. On the right side, there's less. And I think probably some of you have heard the term atherosclerosis. This is what we mean when we say that. This is a plaque in the artery wall that usually just builds over time, and we'll talk about the people and the risk factors that have a higher risk for this. But over time, these plaques build and they cause sort of narrowings here. And so people, when they're having when they're sort of putting their heart, more demand on their heart, when they exercise, when they get excited about something, they're putting more demand on their heart. Their heart needs more blood flow for that demand. And sometimes people might feel chest pain or symptoms when they have that. And that's because of they don't have that ability to increase that blood flow because of those narrowings. But at baseline, they don't feel anything because their body has adjusted. So that's not a heart attack, but that's that typical thing that you may have heard of the term angina or chest pain that people have with activity. And that's a sign that something needs to be investigated further. When we're talking about a heart attack, we're talking about more this last picture here. So you see that plaque that I had identified for you that was initially just causing narrowing. Now that plaque has ruptured or sort of broke open. And so the tissue inside of it, or the cholesterol and the immune cells, are now blocking that artery. You can see on the right side there in the artery, there's no blood flow at all. So that blockage prevents blood flow distally to the heart tissue, and therefore that heart tissue is not getting oxygen, and it starts to feel the effects of that, and the patient feels chest pain as a result. And we see other evidence of heart damage that we can talk more about. So there's sort of a spectrum of coronary disease, and that's sort of that atherosclerosis, that blockage that I was talking about, is sort of within the category of what we call coronary disease. And that says it right here very nicely: plaque buildup within the wall of the artery. Within that spectrum, you have angina, as I mentioned, which is where you have chest pain when you're exerting yourself or getting excited or something like that, and there's not enough blood flow to the heart when the heart is at an increased demand. So that's something that is usually not an acute issue. You don't have to go to the hospital if you have angina, if it's been going on for a while, but it's a sign that you have coronary artery. Should be seeing a cardiologist and maybe should be getting treated for that. And then the sort of farthest end of the spectrum, and sort of the goal of this talk, is a heart attack, where that plaque ruptures and sort of, or as they say, plaque cracks, another way to think of it. And there's a clot now that's blocking that artery, and there's no more blood flow to the heart tissue, and that's what a heart attack is. So what are the normal signs and symptoms that we think of a heart attack? So I've already talked about some of them, and I think classically people think of chest pain. That chest pain can be different for very many people. Normally, we consider it to be squeezing or pressure, and it's usually above the heart, which is on the left side of your chest. And it's not something, if you feel something for a few seconds, that's less likely a heart attack, but something that's sustaining for a few minutes is a little more concerning. Other people might feel short of breath, or they might feel short of breath with that chest pain. They could sort of be feeling sweaty and nauseous. Dizzy is a sign of a heart attack. Sometimes that pain sort of refers to other places in the body. So some people only have neck pain, jaw pain, shoulder pain, arm discomfort, and that's because the nerves that supply that feed that sort of heart tissue also supply those areas. And so that pain is felt somewhere else, but it's truly coming from the heart. So there are a lot of different things that can cause, that sound like a heart attack. And it's important to understand too, that for men and women, the way we experience heart attacks is very different. So men, more classically studied over time, have that sort of more classic symptomatology that we typically see on TV, the chest pain, the shortness of breath, the pain radiating to the arm. Where women, it can be a lot more subtle. Most women feel nausea or vomiting as their sort of typical symptom. They may feel more like lower chest pain or lower abdominal pain, and they may not always feel chest pain itself. They may experience what you'd say indigestion, or sort of after you eat, you feel sort of gassy in your stomach. They may be feeling that. Or just really tired. So there can be, it's important to understand that for women and men, it's different, and to sort of have a high index of suspicion if you can, if something just feels off to you, and not sort of your normal self, and it's within the spectrum of symptoms, it's something to consider. What do you do when you think you're having a heart attack? When you experience some of those symptoms sort of suddenly, either you're exercising, you're at rest, you're in bed, a heart attack could happen at any time. What are you going to do in that situation? And the most important thing is to seek medical attention. So the faster we can diagnose and treat your heart attack, the less likely that your heart will be more severely damaged or permanently damaged from that decreased blood flow. I don't know if you guys have heard the term for a stroke, time is brain. It's the same thing for a heart. So the more time that heart is not getting enough blood flow, the higher probability is that heart tissue is going to be more damaged. So you should be calling 911 and having EMS come evaluate you immediately when you think you're having a heart attack. Don't drive yourself to the hospital, because one of the benefits of EMS is they can start medical treatment once they come and evaluate you. They can give you certain medications, they can do certain diagnostic tests, they can give you oxygen. And if the heart attack is a really bad one, they can sort of provide higher level of care. So I highly recommend that. And then they can get you quickly to a hospital that can treat your heart attack. Because not every hospital has the capability to treat your heart attack in the same way. So that's pretty important. What will happen when you get to the hospital? So initially, you'll come to the emergency room. If that EMS provider has already determined that they think you're having a heart attack, they'll notify the emergency room in advance. And so you'll be expected. One of the tests here that I have a picture here is an EKG, which you guys may have heard of. That's just evaluating the electrical activity in your heart. And there are certain signs on that EKG that can tell us if your heart is not getting enough blood flow. So that's one of the first and most important tests that we do. There are certain blood tests that we can do that can check for heart damage. And an echocardiogram, which is an ultrasound of your heart, can give us a sense of how well your heart is pumping, if there are any areas that aren't pumping as well that might be damaged. So those are sort of typical things that we'll do right in the emergency room. You can get certain medications right there as you're coming in. A lot will be going on, so I don't feel like this is so important that you guys tally all this down, but it's good to sort of get a sense of what you're going to experience. So aspirin is something you guys probably take for pain occasionally, or some of you maybe take it already for heart disease. And that's something that is important for a heart attack, and you will definitely get that if we think you're having a heart attack. And here are some other medications as well that we can talk more about. Most importantly, the statin is something that a lot of people who have heart disease are already taking, and is an important medication to prevent heart disease that we'll talk about later. If we think you're having a heart attack, then we're going to probably take you for a procedure called a coronary angiogram, which I want to talk about. A coronary angiogram is a special X-ray test where we take real-time pictures using real-time X-ray, and can actually look to see if there are any blockages in your heart. So you can see on this picture on the right, this black outline is what that heart artery looks like when we inject dye and we take an X-ray picture. And we've sort of highlighted here this area that's much narrower than the rest of the artery. And so that shows that area is narrow, just like those pictures I showed you at the beginning. And that is a blocked heart artery and could be causing a heart attack. So that's what we're looking for. And It's a very quick procedure. The whole thing takes less than an hour, usually 30 minutes at most. And the other benefit of this procedure is if we do find that you're having a heart attack, we find a blockage or a super tight, narrowed vessel, we can actually treat it right away during that procedure with stents, which I have a picture of down here below. So a stent is basically a little wire straw that we can place sort of within that narrowed artery, and using a balloon, inflate the balloon and sort of expand the stent within the artery. And we can open up that blockage, open up that narrowed artery, and restore blood flow through that artery. So it's a life-saving and immediate procedure that we can do if you're having a major heart attack. That is very important, why we need to diagnose it, and we can treat it right away. So that's the really important thing about a coronary angiogram. I also want to emphasize this is not like an open surgery. This is an invasive procedure. We access your heart via arteries in your wrist or your groin using needles and wires, but we're not opening up your body. We're not cutting you open with a scalpel, which makes it faster and it's less risky than a surgery would be. So if we have diagnosed a heart attack, we've taken you for that coronary angiogram. I already alluded to one of the treatments or talked about one of the treatments, which is the stent procedure. But there's sort of three main ways that we treat a heart attack. And sometimes we can do all three. Usually we'll do two of them, that being usually medications are going to be standard for treatment of a heart attack. So aspirin is important to keep your arteries open. It prevents platelets, which are little sticky white material within your heart that cause clots, or not within your heart, within your arteries that cause clots. It prevents them from sticking together and causing that blockage. So they're very important to both prevent a heart attack and going forward if you've had a heart attack. A statin medication, which lowers your cholesterol, and cholesterol is what causes those plaques, those narrowings that we saw in that initial picture. That's a very important medication to take after you have a heart attack. And then there are certain medications that will put you on to decrease the demand that your heart has. So your heart is an increased demand if it's going very fast, if it's pumping against high blood pressure. So we'll sometimes put you on medications to lower your heart rate and to lower your blood pressure, because that way your heart doesn't have to work as hard and is at lower risk of having that angina or a future heart attack. So those are usually pretty standard. Every patient is going to be put on those medications. The rest is how, sort of depending on how many blockages you have and how complicated the blockages are, whether we'll do that stent procedure right during the coronary angiogram, or we'll talk with our heart surgeons and we'll recommend bypass surgery, which is open heart surgery. And it's a big surgery, it's a big decision, and that's something that we wouldn't sort of emergently go to, and we would all talk together about what that means. But the sort of longevity of that is a really great option for certain patients, depending on how many blockages they have, where the blockages are. So those are the basic treatments that we have. After a heart attack, there are a few things. Now you're a person who's had heart disease, who's had a heart attack. And so it's very important that you have a cardiologist. You'll usually meet a cardiologist in the hospital. They'll be managing your care. So usually you can follow up with that patient in clinic, and it's important that you see them once you leave the hospital, or you see one that's covered by your insurance or within your network, ideally within 2 weeks of leaving the hospital, and that you follow with that cardiologist going forward, because they can help work on managing your risk, which we'll talk about next, and how to prevent future heart attacks and how to protect your heart going forward if it's had any damage from that heart attack. We already talked about medications, and it's for each patient, depending on how badly your heart is damaged, how bad your heart disease, how your heart was treated, whether it got stents or surgery, you'll get different medications. But you should expect that having a heart attack, you'll be on new medications, and a lot of those medications will be lifelong medications. Some of them will be within the next few months, next few years, but Medications are demonstrated to be really helpful in this situation, and so we highly recommend their use. Um, and then we'll talk more about how to reduce your risk of future heart attacks and things that we consider to be risk factors. But that'll be a huge thing going forward that you and your cardiologist, you and your primary care doctor will be working on in the next days to weeks to months to years. And then we recommend that all patients go to cardiac rehab after having a heart attack. And um, cardiac rehab, there's lots of evidence has demonstrated that this prevents patients from having recurrent heart attacks. It prevents them from coming back to the hospital with other heart issues. And it's basically a scaled exercise program in a group dynamic where you'll get to meet other people who have gone through what you've gone through. You guys work together. You improve your stamina and your exercise tolerance, and it's a really useful and recommended strategy after a heart attack. So the last thing I wanted to talk about before I open it up for questions, and I see a few sort of in the chat there, is how we reduce our risk of a heart attack. And this is something important before you have a heart attack. And we can understand why you would be considering that. And it's definitely something after you have a heart attack. There's a lot of research into heart disease. It's obviously one of the heart attacks and heart disease is like the #1 cause of death in our country. So we have as a result, a lot of great understanding about how to prevent heart disease in patients. So I wanted to go through a few important things, and I'm happy to answer more specific questions about this. But first of all, your family history is going to be very important to your risk of heart disease. And by that, I mean, you should be talking to your parents and your immediate siblings and your children. So your immediate family, if they have had heart attacks, if they're a male less than 45 or younger, if they're a woman less than 55 or younger, that's considered premature heart disease, premature coronary artery disease. And that puts you at higher risk of also having a heart attack. So it's important to get that information as today, go home, talk to those immediate family members and get a sense of that, because while you can't change your genetic risk factors, you can change your other risk factors and at least understand your risk and things that you can do, establish with a cardiologist, work with your primary care doctor. So I think it's very important to understand that and talk with your family about that. Another way to reduce your risk is to sort of just aim for a heart healthy diet. And what's recommended and been studied, and that's sort of what this picture is here, is the Mediterranean diet, which I didn't sort of want to go into all the details of that today, but broadly, Mediterranean diet is limiting like red meats. It's limiting sort of processed sugars and white carbohydrates and meat fat like butter and fatty oils, and it's focused more on what you think about like a Greek meal or an Italian meal without the pasta. But using a lot of olive oils, a lot of fish, lean chicken meats, tofu, legumes, beans, and then whole grains, whole grain bread, whole grain pasta even, and lots of vegetables and fruits. So that's sort of what's recommended best for your heart. And then it's also recommended to get active if you're not already getting some form of exercise. Getting at least 150 minutes throughout a week of some moderate intensity physical activity is the sort of recommended amount. But if you're not doing anything, some is better than nothing. So sort of working your way up to that, going for a walk with your partner, your friends, on your lunch hour or in the evening, sort of adding some hills into your walk, working yourself into getting that amount of activity has benefits on your heart and then all the organs that are sort of related to that as well. So it's highly recommended. Also, a way to reduce your risk, which sort of feeds into a lot of these things, is seeing your primary care doctor for regular checkups, because part of what they're doing on those checkups is checking your blood pressure. They're checking your blood tests. They're evaluating your risk of multiple diseases, but part of that is evaluating your risk of heart disease. And so it's really important to see your doctor regularly, and so that you can understand your risk and reduce that risk before you get to the point that you're coming into the hospital with chest pain and needing to go for that coronary angiogram. Specific risk factors to be aware of that you and your doctor will be working on if you are working with a doctor is, number one, the highest sort of modifiable, and when I say modifiable, I mean things that you didn't inherit from your family, risk factors that cause heart disease are smoking, cigarettes, and diabetes. So controlling those two risk factors is paramount to preventing and reducing your risk of a heart attack. So if you are smoking tobacco, working to quit that tobacco as best you can, and completely stopping is really one of the best things you can do for your heart, and for your lungs and other organs. Diabetes control. If you have diabetes or at risk of diabetes, working closely with your physician to get those blood sugars under control, get on medications, work on your diet and your exercise, will also reduce your risk of heart attack, because diabetes, the increased blood sugar is actually damaging the walls of those arteries, and it's causing those plaques, and it's causing that angina that you might have, and it's causing that heart attack. So diabetes really affects our entire body, but it really has a huge impact on our heart. Blood pressure, high blood pressure, similarly, really has a big impact on our heart disease, and getting that blood pressure under control, either if it's with medications that's recommended for you, or some of the two things that you can do on your own that's highly effective for blood pressure control are exercise, which we've already talked about, and weight loss if it's indicated based on your body mass index. So those two things will get your blood pressure under control. They'll help your diabetes control. They'll help your heart disease. But if medications are recommended by your doctor, adhering to those medications, working with your doctor to get your blood pressure under control is really important to prevent helping your heart. And finally, cholesterol. So cholesterol is, fat broadly, and it's what sort of builds up within those plaques and causes those narrowing and that blockage of those arteries. And so getting your cholesterol under control through diet or through medications such as statins, or other medications. There are now, I think, 9 different types of medications to control your cholesterol. And really getting that under control will prevent your risk of heart disease. So I think that's where I was going to stop. And then I wanted to give you guys all an opportunity to ask your questions, and hopefully have a bit of a discussion about this.
Thank you. Thank you, Dr. Cazzulino. There are quite a few questions. So we're going to jump right into our Q&A session now. I'm going to read off the questions in the Q&A chat first, and then we'll open it up to other questions in the end. Just a quick reminder, so during this portion, you can request to unmute or use the raise hand feature to ask your questions verbally. And for those of you joining us by phone, please dial *9 to raise your hand or *6 to mute or unmute. So again, I'll read the Q&A questions first, and then we'll open it up to everybody else.
Okay.
So there's one question. First question is, what is the relationship between sleep apnea and heart health?
Yeah, that's a very good question. So it's a complex relationship, I would say. Sleep apnea, a lot of things that put you at increased risk of sleep apnea also put you at increased risk of heart disease. Broadly, sort of obesity is one of those things that causes it. That's not the only thing. People who are skinny can also have sleep apnea. Usually when we think about sleep apnea, though, and heart health, we think about atrial fibrillation, which you may or may not have heard of, and that's sort of an irregular heart rhythm. And atrial fibrillation can sleep apnea can increase your risk of heart disease. The other thing is sleep apnea actually increases your blood pressure, because sleep apnea, for those who are not aware, basically while you're sleeping overnight, your body is stopping breathing temporarily, and that puts your body under stress. And your body's response to that is to increase your blood pressure. So if you have sleep apnea, treating your sleep apnea will reduce your blood pressure, which will reduce your risk of heart disease. And it could also reduce your risk of atrial fibrillation if that's also a concern.
Okay. The next question, let's see. Oh, I have supraventricular tachycardia. I'm getting care for it. Are there any new treatment or information about it?
So that's a completely different topic than this. It's
Okay.
in that realm of atrial fibrillation. I can briefly say that there are tons of treatments for supraventricular tachycardia. There are medications. There are what we call ablation procedures where they actually burn the inside of the heart. It's really dependent on how you're feeling with that supraventricular tachycardia. Are you having symptoms and how your heart is tolerating it? But that could be a whole other presentation in itself and something that I don't know, Ava, if you guys want to arrange, I think that would be
Yeah,
helpful. Yeah.
we'll get into. So, another one, I have RBBB.
Hmm.
Am I more susceptible for a heart attack or does it contribute to a heart attack?
No, so RBBB, for those who are not aware, is a right bundle branch block. Again, sort of a different part of the heart. So the coronary arteries that I talked about, I like to think of as sort of the plumbing of the heart. And then the right bundle is part of the electrical system of the heart. And so the heart has its own electrical system that allows it to have a coordinated pumping function from the top of the heart to the bottom of the heart. And a right bundle branch block means that there's a slowing or a block from that connection from the top to the bottom on the right side of the heart. In itself, it does not cause a heart attack or increase your risk for a heart attack. Patients who have had a heart attack in the past to that tissue where the right bundle is can have a right bundle, but people can independently have a right bundle branch block independent of having a heart attack. So while there may be some association, it's not really indicative of anything. And having a right bundle doesn't mean that you're in higher risk of having a heart attack or that you've definitively had a heart attack.
Thank you. All right, next question. What happens if LDL is high and not taking medication?
So that's the cholesterol control we talked about. So LDL, I think people may have heard of that as sort of is our bad cholesterol. There are multiple types of cholesterol in our body, and LDL is one that we typically associate with increasing plaques in your arteries. So if your LDL is high and you're not controlling it with medications, usually you're going to be at increased risk of developing heart disease, heart attacks, strokes, kidney disease. It can really impact a lot of things. So I know a lot of people, a lot of my patients don't want to start medications for cholesterol or LDL elevation. And you can try to control it with diet, but some people, like I said, they have a family history of heart disease, and often that's associated with a family history of high cholesterol, and diet isn't going to do the only thing. So I really emphasize my patients who have that to take medications and to try various medications, work with their doctor. If one isn't working, if you're having side effects from it, like I said, there are 9 different types of medications in addition to statin therapy. But statin therapy is our best medication. We've known it's been around for decades. It's really well studied. It's really well tolerated. And there are newer drugs out on the market that are just as effective, but a lot more expensive. But overall, I would highly recommend controlling that LDL because you'll be at increased risk of a heart attack.
Okay, thank you. So the next question, this is kind of a fun one. Pronunciation of angina. Please confirm.
I pronounce it angina. I do know that some people pronounce it differently, but classically, I think most of us cardiologists pronounce it angina.
Angina, okay. All right. So next question, if my parent
Compared,
or
I think
sib
angina
okay.
is another way that people pronounce it.
Yeah, I hear that a lot too, angina. Uh, okay. So if my parent or sibling had a heart attack, does that automatically put me in at high risk? How should I interpret a CT scan? Oh, it's a two-part question. How should I interpret a CT scan showing a partially blocked artery?
Okay. Yeah, those are both good questions. So, um, if your parent or sibling had a heart attack, it might put you at increased risk. Part of it, like I said, depends on their age when they had a heart attack. So if they were younger, it does put you at higher risk. I think, though, unless they were in their 80s or, it's towards the end of their life, age is our greatest risk factor for most diseases, cancer, heart disease, etc. So unless it was like towards the end of their life, I would get yourself checked out just by your primary care doctor. Check your risk factors, check your LDL, check your diabetes. If you have diabetes, check your blood pressure. If you're smoking, consider stopping that for multiple reasons. So again, to say it's a heart a sort of specific risk factor depends on how young they were. For a man, around 45 or less; for a woman, 55 or less, and that's the family member. And then a heart CT scan is a study where, compared to sort of the coronary angiogram, which is an invasive study where we're going in through an artery with needles and wires, a CT scan is sort of, you go into that tube. Maybe some of you guys have experienced, it's a non-invasive imaging study, X-ray study as well. And we actually have technology now where we can look at those coronary arteries that I showed you the picture of at the beginning, and find certain blockages on there. We can also get a sense of your plaque burden by evaluating how much calcium is in those arteries. Some of you may have heard of a calcium score from that. So the calcium score gives us a good sort of idea of your prognosis, and if it's high, you should be on cholesterol medications, and you should be evaluating and sort of reducing your risk. If you have blockages found on the CT scan, it depends how severe they are. So the CT scan is limited in certain ways. It's not as good as the coronary angiogram. So if those blockages are moderate to severe based on what they're seeing on the CT scan, what your cardiologist or primary care should be getting you to have is the coronary angiograms, because that would be the definitive test. So it's a good screening tool. We can see a lot of information, but it does have limitations. So if there's any concern of blockages and symptoms, you should get that coronary angiogram.
Thank you. Let's see. How can you tell the difference between a heart attack and gastric indigestion?
Yeah, that's a good question. And sometimes you can't, honestly. Like I said, a lot of women experience a heart attack as feeling sort of gastric indigestion, but classically, the scenario will be useful to you. So if you feel what you think is gastric indigestion every time you're climbing a steep hill, if you're climbing that steep hill and you start to feel it and then you stop and it gets better, and you don't feel that same symptoms when you're eating spicy foods or gassy foods, or when you lay down at night after eating a big meal, that's probably more likely your heart, because like I said, when your heart is exercising, increasing its demand, if there's a narrowing there, you're going to feel angina. And for some people, angina is that indigestion symptom. Where if the indigestion you're having is usually always associated with a meal or at the end of the night when you're laying down after you've eaten and food sort of moves up into the sort of tube between your stomach and your mouth called the esophagus, that's usually more indigestion. In terms of an actual heart attack, I think it would depend on, does this feel, if you're feeling that indigestion symptoms, are you noticing other signs of that we sort of talked about a heart attack? And I can go back to that slide. Are you feeling nauseous as well? Are you feeling short of breath? Are you feeling lightheaded? Are you dizzy? Are you sweating? Are you feeling other things? And is this unusual for you? Did it happen all of a sudden and it's not going away? I think those would be less typical for indigestion, would be more typical for a heart attack and might warrant further investigation. And I think really one of the takeaways is, if there's anything that you're concerned about, if you think you're having a heart attack and something feels wrong to you, you should seek attention, medical care, because if you're right, you could be protecting your heart, and protecting yourself going forward. And if you're wrong, then we just, give you that reassurance. It's no harm done.
Thank you for that. We have about 19 questions, so I'm gonna just, I
Yeah,
won't be
go
able to
ahead.
ask all of them, but let's see. What are the most common warning signs before a heart attack? If one suspects a heart attack, what are the three most important things they need to do immediately?
Okay, so I think that sort of covers some of the stuff we hear. I mean,
Yeah.
most common chest pain, shortness for it sort of depends if you're a woman or a man, but chest pain, shortness of breath, nausea, vomiting, and sweating, I think are the things we usually see. But it really depends for whoever it is. And I think if you already know you have some of those risk factors for heart disease, that might increase your risk. But those would be the things that I would typically say. And then the top three things to do. Number one, call 911. Rest, don't exert yourself more because any exertion you do is going to put your heart at increased risk, or put your heart at higher demand. If it's already not getting enough blood flow, you don't want it to get less blood flow by, running around or something like that. I didn't put this here, but it wouldn't be a bad idea if you have a baby aspirin or a aspirin or a full strength aspirin to take that. As long as there's no other reason that you shouldn't be taking that, like kidney disease or bleeding in your belly or something like that. Because that's what we're going to do when you get to the hospital. That's what EMS is going to do. They're going to give you that aspirin. So it's a pretty low risk in that setting and could be really helpful.
Thank you. I'll do one or two more questions and then open it up. Where was it? Is stroke and heart attack related?
They are. So a stroke is basically a heart attack of the brain, and a heart attack is basically a stroke of the heart. They're both situations where the brain or the heart suddenly doesn't get enough blood flow and tissue is being damaged, and so you have symptoms as a result of that. And they are both caused by almost the exact same risk factors. So diabetes, high blood pressure, high cholesterol, smoking, family history of heart disease, all are risk factors for strokes and heart attacks. A lot of the same medications prevent them. And both of them, for a stroke, it's sort of a blockage in the arteries going up to your brain. And for a heart attack, it's the blockage in those arteries feeding your heart. So they're very similar. They have similar risk factors, similar treatments. It's just different organs involved.
Perfect. Thank you. Okay, one more in the Q&A chat. Oh, where did it go? Let's see. Do other diseases that trigger strong immune responses increase the likelihood of heart attacks? Is any sort of increased physical stress a stress factor?
Yes and yes. And so that's something I didn't bring up, and that's a good point. So if you have increased inflammation in your body from multiple things, cancer can cause that, autoimmune diseases can cause that, HIV or chronic infections can cause that. Those all damage your heart arteries and can put you at increased risk of a heart attack. So definitely those are risk factors that we consider when we're considering a heart attack. And then stress definitely can affect your heart. Chronic stress on your body in that same way can impact your blood vessels. It can stress, sort of acute stress, so emotional stress, physical stress, puts more decreased demand on your heart. Stress increases your blood pressure, it increases your heart rate. These are all things that put more demand on your heart. So sort of indirectly through the ways that your body responds to stress can definitely impact your heart. I don't know, was there a part of that question I didn't answer? I sort of forgot the second part.
It's okay. We're actually going to continue with just a few more questions, and then
Okay.
if anybody has a few more to jump right in the QA box. Let's see. What about COVID and heart disease?
So that's also a big topic. sort of also different topics. So there's less risk of heart attacks with COVID. Um, it can cause it because COVID has been shown to cause clots in your body, and clots can travel to your heart arteries and cause a heart attack. So that's less common. I think classically, when people think about COVID and heart disease, they think of myocarditis, which is basically an infection of the heart muscle. Um, so the and that's something we definitely have seen. It's true for all viral infections, honestly, can infect the heart muscle. And that's something that patients, you can have a wide range of symptoms with that. The most extreme is you sort of have heart failure as a result of that and need to be admitted to the hospital. And the symptoms of that would be shortness of breath, weight gain, swelling in your legs. It's less classically chest pain in that scenario. But that's definitely something that we, I think, see a lot less these days. But during the pandemic, I know that I was seeing that a lot.
Thank you. Let's see. What should someone do if they experience a heart attack while driving or asleep?
Um, yeah, so that, I mean, that's definitely possible. I would say if you're having a heart attack while you're driving, I would pull over and call 911 because I know you're in your car already and it seems tempting to drive yourself. Um, but you don't know how severe things are going to get, and you don't want to put other people at risk and put yourself at higher risk by, some people who have really severe heart attacks, they lose consciousness. They have dangerous heart rhythms because of their heart attack. Their heart stops. These are, sort of the end spectrum, the more dangerous spectrum of a heart attack. A lot of people just have chest pain, but it's unclear how that's going to go. So I think to be safe for you, to be safe for for the people around you, I would pull over and call 911 while you're driving. While you're asleep, some people do have silent heart attacks. I would say they don't have any symptoms at all. They're more common than women. So it's possible when you're asleep, if the pain is not that severe, if your symptoms are not that severe, you may not feel it. But classically, people will wake up with chest pain, and you would treat it the same way you treat it here. You're calling 911 immediately. It shouldn't be sort of treated any differently.
I think you covered some of this, but how do heart attack symptoms and warning signs differ between men and women? Are there specific screening tests recommended for women?
Yeah, so I think we talked about the men and women, and
Right.
I'll leave this up here for people to take a look at. Just very broadly, I would say women have sort of more subtle symptoms often than men. As far as screening, there's no specific screening that's better for women than men or indicated for women than men. But I would say that women have certain risk factors that men don't have. So um, estrogen is sort of a protective thing for women in heart disease, and that's why classically they were thought to have lower risk of heart disease. But so being post menopausal is a higher risk. Being on actually exogenous estrogen is a risk factor, and then certain things that happened in your pregnancy, if you had high blood pressure, preeclampsia, if you uh, had sort of PCOS, which is less about pregnancy, but more about sort of gyne issues. If you had multiple miscarriages, there are certain sort of parts about a woman that men don't experience that put them at higher risk of heart disease. So I think just understanding your own risk factors as a woman and talking with your primary care, your cardiologist about those risk factors, and how that might put you at higher risk, even if you don't have those classic symptoms.
Thank you. Does an enlarged, where did it go? Does an enlarged heart provide any symptoms before a fatal coronary event?
So yes and no. So a large heart can be enlarged from many things. It can be normal. It can be a sign of, usually it's more a sign of heart failure. And there are a lot of things that cause heart failure, and a heart attack can cause heart failure. Um, so the symptoms that people experience from heart failure, which is usually, if you have just an enlarged heart, you probably don't have symptoms in itself. But if you have heart failure, that means that your heart is not pumping blood well enough forward, and blood often, as a result, pumps sort of backs up. So From the left side, it backs up into the lungs, so people feel short of breath. Blood sort of pools when you lay flat. So if you're having difficulty laying flat at night, that can be a sign that your heart is enlarged and failing. If you notice progressive swelling in your legs, that's a sign that blood is sort of failing from the right side. If you're sort of gaining weight sort of quickly over a period of time, that means fluid is accumulating outside of your heart and the arteries, and that can be a sign. So those are things that we often think about as signs of heart failure, which are sort of independent from heart attacks. Though again, heart attacks can cause a weakened heart and therefore heart failure.
Thank you. When is an EKG necessary and when is a stress test recommended?
So an EKG is necessary in diagnosing a heart attack. As I sort of talked about before, it basically can show us different electrical abnormalities in the heart that show us if you're having an acute heart attack or not. That being said, an EKG can be normal and you can still be having a heart attack. But it's something that we get regardless. It's cheap, easy, and it's really effective at diagnosing certain heart attacks. And blood tests are sort of our supplement. And often the story that you tell us is sort of one of the most important things. So none of those tests are replacing the symptoms you're having and what happened to you. And then a stress test is something that we get not in a situation of a heart attack, but sort of before a heart attack. So a stress test, there are multiple different types of stress tests, but I think the most common one we associate is sort of running on a treadmill and having an EKG, continuous EKG, monitoring to see if we see any signs of a heart attack on the EKG. And that's something we do for patients who are sort of at intermediate risk of heart disease. So maybe they have some of those risk factors we talked about. Maybe you're having this new chest pain when you go for a walk up a hill or when you're lifting heavy boxes. Maybe you have a significant family history of heart disease and your cholesterol is elevated and you have multiple risk factors, but you're not really having symptoms. So a stress test is something we use to sort of better evaluate whether we think you have heart disease. It can be a step on the way to getting a coronary angiogram, depending on your risk factors.
Perfect. Thank you so much, Dr. Cazzulino. I think we're going to go ahead and wrap this up. Thank you all for joining today's presentation. A very special thank you to Dr. Cazzulino for taking time out of your busy schedule to share your expertise on this important topic. We've Lily put in the link for our next presentation. We all invite you to weight loss medications and your heart, what you should know and what's next. And that is on Thursday, April 10th at 4 p.m. Thank you all again and have a wonderful evening. Thank you, Dr. Cazzulino, again.
Thank you so much. It was a pleasure to join you all. I hope I was able to answer some of your questions. I'm sorry if I didn't get to all of them, but if you have any questions, your primary care doctor is a great place to start, and they should be your first screening tool towards getting to seeing that cardiologist. And that's my plug to see your primary care doctors, establish with a primary care doctor, because they're going to sort of help you with that risk and prevent those heart attacks. Right. Have a great evening, everybody.
Thank you, everybody.
Thank you.
Thank you.